All right, now let us talk about some current affairs going on in India and related to the state to which I belong to, Odisha. A patient in Odisha presented to the emergency with high grade fever for 2 days with altered sensorium. There is a history of vomiting and diarrhea as well. On examination, there is an eschar on the lower limb with a black central crust, right? Vomiting and diarrhea is related to the state for empirical treatment. It is the latest guideline, right? All right, now let us talk about some current affairs going on in India and related to the state to which I belong to, Odisha. A patient in Odisha presented to the emergency with high grade fever for 2 days with altered sensorium. There is a history of vomiting and diarrhea as well. On examination, there is an eschar on the lower limb with a black central crust, right? There is also a maculopapular rash on the abdomen. Which of the following drugs should be given to the patient? All right, so as all of you know, um, this is something that I have, picked up from the news that in Odisha, what is going on now. Excellent, guys. So if you have been watching news, you would have been aware of what I'm talking about here, scrub typhus, right? So scrub typhus outbreak has been seen. All right. Now see, you jumped onto option B, oral doxycycline for 7 days. Okay, guys, try to understand. या फरहान अहमद आई नो एम्स में जरूर आएगा पूछेंगे इसीलिए मैंने एमसीक्यू दिया है एंड आई सेड दे विल आस्क यू दिस नाउ यू हैव टू अंडरस्टैंड when I say altered sensorium, it means what? Probably he has already developed meningoencephalitis. Probably he has developed meningoencephalitis, means involvement of brain and the meninges is there. So the infection, it comes into severe category. And if it is severe category infection, see, most of you have given answer as B, but see guys, B will not be the answer. For this particular patient, I have to admit the patient and start on IV doxycycline for 7 days, right? So usually, if the patient is stable, if the patient, there is no CNS involvement, in that case, I can go for oral doxycycline and I can save almost all patients. The only problem is with the diagnosis. People, when they cannot make the diagnosis, that is when people die. If you can make a diagnosis, you can get a very good drug like doxycycline, oral or IV, depending upon what is the severity of the patient. So anyways, you guys tried. B is not the right answer in this case, but it is not a stupid answer.